I think the first thing to bring your attention to, because it's pretty new news, is that for the second year in a row, Owensboro Health has placed in the top 2% of hospitals in the country in quality outcomes. So we've still got work to do. Obviously, we continue to raise the bar and get better at what we do, but it's nice to be recognized by an independent health firm when they look at what is quality care across the United States, and know that we have an asset that has been built on quality and patient service for the last few years, and then recognized in such. Being in the top 2% of hospitals is significant. We're one of only 2 in the state of Kentucky. The other one's over near Cincinnati, and the only one in the region, as you have to go basically to Indianapolis to find one over the list. But also, though, it's been a 6-year journey, as you can see, as we've continued to build on our excellence from 2009 as being a distinguished hospital for quality of care. I think most of you are aware of the new building. I know there was a big campaign with it and opportunities for everybody to come see it. But it truly is a beautiful state-of-the-art facility with many of the physicians now placed on that campus in conjunction with the care that goes on, which I think is going to lead to a continued growth opportunity, as well as continued quality outcomes as we continue to serve the region, obviously. But expanding from here on out for Owensboro Health will really not be on the Pleasant Valley campus. As we look at our Pleasant Valley campus here in Owensboro, it will be the hub, but as we continue to grow in that regional mindset that the board has set for us around our mission to serve all our communities, you will see the growth of Owensboro Health as we move out. But it won't be in a traditional growth model where the system owns a lot of what we do. Our goal is to partner with the communities, partner with the providers that are there, whether those be hospitals or the physicians that are already in place. I think one statistic that's actually I borrowed from the epidemiologist from the region actually shows the breakdown of the number of providers in the region across the district. And as you can see, the Green River District is on the left. Owensboro Health is the second statistical column there, and the percentage of what Owensboro Health actually employs within the region of the total number of providers, which basically presents itself pretty well. We now have within our employment 1/3 of all of the providers in physicians and nurse practitioners in the entire region. So we've technically learned to extend our boundaries through growth. Most of that has been organic, as we have partnered with physicians in each of your communities, as well as bringing new resources to bear, as we should be able to do as a hospital system, to make sure that you have access to care throughout the region as close to your home as possible. What's significant about this, if you look at our employed numbers for physicians in 2006, we only employed 26 physicians and extenders at that point in time. Today, it's well over 130. So as that has continued to do, it is a trend that is continuing across America, so it's not unique to Owensboro Health, as most providers and the government are pushing providers to work together more in concert and looking towards managing the health of the population instead of just directly at volumes. I think it's important to recognize the parish campus again, our old campus, as where most people had loved ones, whether that would be cared for in their life or begin their life on this campus, was the home of Owensboro Health for a number of years, whether that was in previous names or lives. It is still going to be a very important part of our community as we continue to reach out and grow that campus, but in a different way. It will become our education hub, as well as continue to be our coordinated group for continue with Macaulay Clinic, which is our free clinic, as we continue with the mission that started through the Mercy system, continued as Owensboro Health, that we will take care of everyone in our community, not just those who are insured. And even though that there will be expansion of, oh, I got caught up on here, expansion of insurance through the federal government and the direction it's going, there still will be always those who are marginally or don't have any coverage. And we will continue to take care of those. But a lot of the things that we're doing in modernizing this campus and continue to look at partnerships as we grow as Owensboro Health, as I said, would not be on the Pleasant Valley Road. We will continue to keep our Mitchell Memorial Cancer Center on this location. We have the Cancer Research Program, which is our partnership with the University of Louisville and the Brown Cancer Center for research. There's a lot of wonderful things going on at that campus as we continue to look for answers to a big academic problem that we have in our country with cancer, as well as other tough battles that we have and have no answers for now, as we continue to push the envelope to make our community better through research. We also are expanding our School of Nursing. We currently have over 60 nursing students from the University of Louisville on that campus as they do education and clinical rotations through our system. We are looking to add to that at the next stage with residents for the physician side, as we will start bringing on family practitioners and other subspecialties between now and 2016 to expand not only the care capabilities and through bringing and educating new physicians, but then retaining those physicians here for our community as our community continues to grow. We love our relationship that we have with Coast Children's Hospital. We do have a number of their clinical subspecialists specific for pediatrics who rotate through those clinics so that those children who have higher end diseases that are not easily diagnosed and treated by general pediatricians can have a local option instead of having to go all the way to Louisville for care. This is what will be out of the remaining parish campus hospital as we continue to tear down the old hospital itself. The remaining place in the center of the campus will be the main clinics. The blue part will be the future home of Macaulay, the Macaulay Clinic. And as we combine that with our education session and our residency program, which is the green area, the care coordination and cross-utilization of the space will allow us to see many more people from that area of Owensboro, as well as anybody else who comes in and would like to seek care at that option. We are currently also continuing to look at new opportunities and new partnerships for other space that is still available on that campus because we want to truly make that campus a continued part of the future of Owensboro Health. I think it's important to look at where we get our patients from. You see the blue area obviously is Davis County. We get about 2/3 of our patients still at Pleasant Valley from that area, as well as our secondary markets, which is the blue area. Most of that encompasses the same district as GRADD, but we do have a few other areas where we pull from that are outside of the district itself. But you go from primary service area to secondary service area, which is the blue, and then the yellow is actually where we still get patients from, even though it's a smaller number. We show that the footprint of Owensboro Health continues to reach out as we grow in our ability to serve our populations closer to home. So it's nice to see that we have an asset in our region. What I'm excited about, and I've spoken to a number of you in this room about, is that I believe that my passion around working with Owensboro Health, being a partner to our current other providers within the GRADD district, is similar to what you're doing. And that is in partnership working to provide a better economic and healthy environment with which we live currently and which we will leave for our next generations here. And that's truly what we are looking for here at Owensboro Health and where we're headed. So we're not looking to own everything. We're not looking to control everything. What we're looking to do is improve our own performance and improve those in those who are in need of care, their outcomes and their access to health care as we continue to address the future needs of our community. So with that, I've only got 15 minutes, so I thought I would end there and just take a few questions if there are some from the group.
I have one, not that it's been discussed anywhere else, but what will the Affordable Care Act do to move forward? What are your concerns, not to disparage the act, but what are your concerns running the system with the Affordable Care Act, and how do we compensate?
Well, I think the importance, just to stay out of the political realm of it, disparaging something that we're going to have to live with, it really just doesn't get us anywhere. And so you're right about that. But, I think it's important to say is that I think the true premise of why the Affordable Care Act was put in place is a noble one, for making sure everybody has access to care. I don't believe that the current structure that it is provided under is going to live, whether that's through government process or just through the structure. I don't think it is one that will be sustainable. So there will be changes coming to the Act. With that said, though, I believe that population health as we know it, which is also community health-based structures of healthcare, will continue to press forward as we are expected to do more with less and maintain, or if not improve, the health of our communities as we continue to build towards the model of the future. We can't stay where we are today. The Affordable Care Act, which I don't think is affordable, and really doesn't address care, but what it did was it actually shortened the life of Medicare. So Medicare was supposed to go broke in 2017, it's now 2016. So they've got to address what the current issue is, which is that this is the current process of healthcare in America is not sustainable the way we've got to do that. And that is that we've got to push the paradigm to keeping people healthy. The majority of what we spend today is on chronic disease. And if we do a better job at maintaining people's health and keeping them out of hospitals, it's weird for people to think of a hospital CEO saying, I want to keep people out of the hospital, but I truly believe that's what we have to do, and I'm engaged in doing that. We were able to build an accountable care organization, an ACO, at my last organization, along with medical homes throughout our primary care base, which basically sets in place that specific issue, which is keeping your populations healthy. So probably I'd end with the fact is that it actually, the premise of the ACA actually marries up with the mission statement of Owensboro Health, which is not only to heal the sick, but to improve the health of the communities we serve. So I think it lines up. We just have to find out how to do that in an economic model that works.